Washington President Trump announced on Thursday that he was directing his Department of Health and Human Services to declare the opioid crisis a public health emergency, taking long-anticipated action to address a rapidly escalating epidemic of drug use in the United States. The move falls short of Mr. Trump's sweeping promise to declare a national emergency on opioids, which would have prompted the rapid allocation of federal funding to address the issue. The directive does not on its own release any money to deal with a drug crisis that has become a grim reality across the country, claiming more than 59,000 lives in 2016. But it would allow some grant money to be used for an array of efforts to combat opioid abuse and would ease certain laws and regulations to address it. No part of our society, not young or old, rich or poor, urban or rural, has been spared this plague of drug addiction and this horrible situation that's taken place with opioids, Mr. Trump said at a ceremony in the White House East Room attended by families affected by opioid abuse, members of Congress and administration officials. This epidemic is a national health emergency. We cannot allow this to continue, Mr. Trump added. It is time to liberate our communities from this scourge of drug addiction. The announcement was intended to fulfill a vow that the president made when he assumed office to make tackling opioid abuse one of his top priorities. But he has so far taken limited action to carry it out. Administration officials argued on Thursday that a national emergency declaration was not necessary or helpful in the case of the opioid crisis, and that the powers associated with a public health emergency were better suited to address the issue. The Trump administration, they said, would work with Congress to secure money to combat opioids in a year-end spending package, including through the Public Health Emergency Fund. They outlined Mr. Trump's announcement on the condition of anonymity to avoid preempting his speech. Mr. Trump said his plan would include bypassing a rule that bars Medicaid funding from being used for many drug rehabilitation facilities, requiring federally employed prescribers to be trained in safe practices for opioid prescriptions, and a new federal initiative to develop non-addictive painkillers. He also said the government would produce really tough, really big, really great advertising aimed at persuading Americans not to start using opioids in the first place. This was an idea that I had, where if we can teach young people not to take drugs, Mr. Trump said, it's really easy not to take them. He shared the story of his brother Fred, who he said had struggled with alcohol addiction throughout his life and implored Mr. Trump never to take a drink advice the president said he heeded. We are going to overcome addiction in America, the president said. In August, Mr. Trump called the opioid crisis a national emergency. But he did not sign a formal declaration designating it as such, allowing the prospect to languish amid resistance in his administration about making an open-ended commitment of federal funds to deal with an issue that has shown no signs of abating. The crisis has claimed tens of thousands of lives, a death rate that one administration official noted Thursday rivals the number of Americans killed during the Vietnam War.